Hi everybody, it's Friday, which means this is this week's episode of The Doctor's In Live with TOA. I'm Stahlman, I'm your host. I'm an orthopedic surgeon with Tennessee Orthopedic Alliance, and I practice primarily spine surgery. These episodes have been something that we put together to try to help give you some information about orthopedics, about musculoskeletal care, and general health. I hope they've been valuable. I hope everybody is remaining safe and quarantined if necessary. These are weird and trying times. And believe me, everybody out there who's trying to decide what's best for society is really making an educated guess. There's no right answer here. We don't know what's going to happen until it happens. So be patient with yourself, be patient with one another. Healthcare industry is doing the best it can to try to keep people safe. As with all these episodes, I want to make sure you understand that yes, I'm an orthopedic surgeon, but I'm not your orthopedic surgeon. And that means that this information should really be considered for educational and entertainment purposes, not medical advice. If you have an orthopedic problem, if you have a musculoskeletal problem that you need addressed, please go to TOA.com, see one of our specialists. Throughout Middle Tennessee, we're the largest and oldest group in the area, and we can find somebody to help you get back to your regular life. Additionally, during this COVID-19 period, I want to remind everybody that most of our physicians are also using telemedicine to reach out to patients so you do not have to come into the office to visit with your physician. Now, telemedicine visits don't work for every problem. Obviously, we can't lay hands on people and touch or examine somebody. Obviously, we can't get an x-ray and look at it right there, but it's a very useful tool to help you follow up with your physician, help you get continuity of care, and allow you to come to the doctor without having to come to the office. So consider that. Go again to TOA.com. There's a tab at the top of the front page that will lead you to our telemedicine instructions, and visit with your doctor via telemedicine. It works pretty well. So we've talked a lot over the episodes about various topics. I'm a spine surgeon, so we've tended to talk about spine surgery. We've started to talk with other physicians in the practice about their areas of expertise, but in this day and age of self-quarantining or social distancing, you're kind of stuck with me for a little bit. So today, kind of in celebration of the craziness out there, I thought we could talk a little bit about the myths around lower back pain, around spine surgery, around spine care in general. There's a lot of them out there. Myths, wives' tales, misconceptions. Now, I don't proclaim to be able to tell you everything is true or false. A lot of this is my opinion, but I've been in practice for 25 years. I've heard a lot. I've seen a lot. I've been very interested to see what's out there on the internet, and it kind of amazes me how much bad information is really out there. So I thought today we could kind of go over some of the most common myths and misconceptions that I hear or see in daily practice, and try to help understand where that's coming from. So I've got a list of things that I pulled up and created. Some of it is from my own practice, some of it is from conversations I've had with patients or colleagues, some of it is coming from searches on the internet. So let's see what comes out of it, okay? So I've got a list here, so you'll forgive me, I'm going to look down at my list so I don't forget things. There's nothing in any specific order. I'm going to just start talking about random things, but let's see how this goes. I want to check one thing, make sure we're running. Sorry, yes we are. I'm by myself in Stahlman studio, so I don't have my team with me. Anyway, so let's get started. So probably one of the most common misconceptions out there is that if you're young, you're healthy, you're fit, you're immune from having back pain. It's the people who are unhealthy, unfit, old, lazy, that have back pain problems. And that's just absolutely not true. I tell most of my patients, everybody, or almost everybody, will have at least one episode of back pain that takes them to the doctor, and many others that never take them to the doctor. Does that mean there's something terribly wrong? No, not really. What it is your spine is an extraordinarily complicated structure. It does lots of things. It allows us to stand upright. It protects our nerves. It protects our organs. It allows us to move in a magical amount of ways. But because it's so complicated, little things can throw it off and symptoms can come about. Now, the vast majority of times when somebody has an episode of back pain, even the episode that's truly frightening, where all of a sudden they can't move, they feel locked down, they feel like somebody shot them, most of the time that will be a self-limited episode. A little bit of reduction in anxiety, a little bit of patience goes a long way in the vast majority of people getting over these episodes. Interestingly, low back pain is the second most common reason why an adult goes to their doctor to seek care. That's an awful lot of visits. The thing that's the most common thing that brings people to the doctor is the common cold. So you can imagine how many people go to the doctor's office for back pain. The good news is by and large, those episodes don't mean much in the long term. Another misconception is somebody has severe back pain and immediately their mind goes to, oh my God, I could be paralyzed. There's almost no reason, except one or two, that I can think of where an episode of acute back pain has any risk at all of being paralyzed. The only two things I can think of are if someone has a tumor or a fracture in their spine that's putting pressure on the spinal cord or could potentially put pressure on the spinal cord, or they have an infection in their spine, and that can lead to pressure on the spinal cord. Other than that, without a history of trauma, such as a motor vehicle accident or a fall or striking your head, an acute back pain episode is just not something that could potentially lead to paralysis. That's an anxiety-provoking thought, but fortunately we don't have to really worry about that. Another misconception is that exercise is bad for your back. Actually, that's farthest from the truth. Now, there are certain types of exercise that can aggravate back pain or make somebody who has a problem with back pain worse, but it's not causing the back pain. The back pain is typically coming from the moving parts in the spine. So that's the joints, the discs, the muscles, the ligaments, the things that hold us together. Exercise, particularly repetitive exercise, such as jumping, running, walking long distance, those types of repetitive pounding activities can aggravate someone who has back pain or somebody who has some degenerative changes in their spine. And the reason why is, as we repetitively pound our spine, we're essentially forcing gravity to squash us together. And that has been shown to be an aggravator for back pain. But exercise is really not causing the back pain. It's aggravating an underlying anatomical process. Exercise is actually good for your back. We recommend just about everybody who comes in to the doctor's office for back pain, we recommend exercise such as core strength, flexibility, aerobic conditioning, trying to stay away from a sedentary lifestyle. Now, exercise doesn't mean everybody needs to do CrossFit or everybody needs to be a power lifter or a marathon runner. In my experience, I think really movement is the best medicine. I recommend people keep or increase their movement each day rather than being sedentary, spending a lot of time sitting or a lot of time standing. So exercise is actually beneficial for your back in the majority of cases. It can aggravate a chronic low back pain problem. It doesn't mean the exercise is bad. It just means that that particular action is irritating. And using other exercises that don't pound your back are commonly things people can do and to help keep themselves fit. Okay, one of our very first episodes was talking about herniated discs. The discs are the rubber shock absorbing pads that sit between the bones in the front, and they allow movement and shock absorption. A herniated disc is where the wall of the disc breaks down, a weak area develops, and some of the central part of the disc, called the nucleus, pushes out and oftentimes can push out toward the nerves. Herniated discs are pretty common. One of the myths and fallacies about herniated discs that people say a lot of, oh my gosh, I've been diagnosed with a herniated disc, that means I have to have surgery. That's really not true. And in fact, studies have proven that probably somewhere near 90% of herniated discs resolve on their own. They don't need surgery. So it's a painful problem, and in some people, surgery is the best option for them, especially in those people who failed other non-surgical treatments, haven't gotten better, or they're showing us signs of nerve damage such as weakness, loss of reflexes, difficulties with getting about. But the vast majority of people who have a herniated disc never come to surgery. That's just clearly a myth. Another thing about the disc that is very commonly discussed, and this comes about typically because an MRI is read by a radiologist. The primary care doctor reads the report from the MRI, doesn't look at the MRI pictures themselves, and the radiologist and the primary care physician reports, you have bulging discs. And somehow bulging discs is suggested to people to be something that's really abnormal. Obviously, discs aren't meant to bulge, therefore they must be bad, therefore that must be the source of my pain. Actually, bulging discs are a visible sign of discs degenerating or wearing down. As our bodies start to break down, and aging is relative. Aging isn't a number. Aging is in my opinion, a process of breakdown. So we start to see the degenerative changes or breakdown related changes actually fairly early in many people on pictures. We start seeing symptoms most commonly late 20s, 30s, 40s, and then on up. But bulging discs are one sign on an MRI of degeneration of the disc. The first thing that happens in the disc is it loses water, it becomes dehydrated. On an MRI, it looks darker than it used to. Water is white on an MRI. As the disc starts to degenerate further, gravity starts to squish it down. It tends to collapse. The height of the disc shortens. And as that occurs, the disc can widen out. Imagine stepping on a Coca-Cola can. When you step right down on a Coke can, it tends to widen out some. That's really kind of the disc bulge process. Now, bulges, protrusions, herniations are all kind of on the same spectrum. Bulges are mild enlargement of the disc. Protrusions are moderate. Herniations are protrusions that have now escaped the wall of the disc. But most of the time, disc bulges are not something we consider very symptomatic. They're very common. And in fact, if you look at an MRI, and they've done studies where people have looked at absolutely asymptomatic patients, and put them in an MRI and look to see what they saw. So there's no symptoms. So presumably their spines should be normal on the MRI. And what they found was that at least in the 30-year-old age group, and I'm kind of ballparking here, about 30% of those folks showed signs of disc degeneration, disc bulging, spinal stenosis, even disc herniations. And these people had no symptoms. As we age further, and they looked at the 60-year-old patient population, ballpark, at least 60 to 70% of patients showed disc herniations, spinal stenosis, arthritis in the spine, bulging of the discs. So what that tells us is the MRI is very sensitive at looking at structure, but it is not very specific when it comes to telling us where the pain is coming from, because we can see those things on an MRI in a normal person with no pain and kind of scratch our heads and say, well, how could that be? If a disc bulge is painful, if a disc herniation is painful, why aren't those people having pain? And really what that tells us is not all things that we see on the MRI are painful. And that's an important thing to think about, because if you just go by the MRI report and don't take into consideration the patient, their symptoms, where they are, many people would say, oh, well, that person, by the report, needs surgery. Well, if the patient's having no symptoms, who would operate on that person? So it's really important to understand that MRIs don't make a diagnosis of pain. MRI can't see pain. CAT scans can't see pain. X-rays can't see pain. What those pictures do tell us is structure. So we can look at those pictures, look at the structure, and then we have to take the context of the patient and say, okay, he has this symptom complex. What pain problems does he have? Could that be attributed to by the findings that we see on the MRI? And we have to match those up. So that's another myth, that an MRI is the definitive diagnoser. Patients come in all the time with, one-day history of back pain after bending over in their yard and say, I need an MRI. Well, the majority of time their pain will just go away. The MRI will be essentially normal, and it's a complete waste of their money. So we don't recommend going to an MRI right away unless we hear the patient tell us certain things, such as they have weakness or severe numbness and neurologic changes in their legs. They had a traumatic event such as a fall or a motor vehicle accident or something like that. They have a history of cancer. They have a history of infection, and we're concerned about those types of items that are considered red flags. Then we would move more quickly toward an MRI. But probably 99% or greater of people that come in with acute low back pain, there is no reason, no indication for an MRI because it doesn't give us the entire answer. Okay, so let's go back to the back pain thing. This was big when I was in training 25 years ago. We learned by that point, well, let me step back. Prior to that point, when somebody had an acute episode of back pain, they locked up, they couldn't move, doctors, therapists, pretty much everybody, way before I was in training, would recommend bed rest. And they put people at bed rest for weeks. What we discovered is that while maybe a day or two of taking it easy seems to settle those acute episodes down some, prolonged bed rest is actually bad for you. It's detrimental. And the reason why is you start to become stiffer and weaker if you lay around. And so, again, going back to the exercise is good for your back. When somebody has an acute back pain episode, the last thing we really recommend is strict bed rest. What we really recommend is take it easy for a couple days and then reintroduce yourself back into movement, because those will help reduce the duration of time that one of these episodes will take to get past. So we don't recommend bed rest. That's an old wives' tale, And hopefully we can cross that one out of the books, because that one never really did make much sense. A very common complaint that people have that scares them, that concerns them, and therefore is essentially a warning flag in people's minds is, well, I turn my head or I turn my back and my neck cracked or popped, or I've noticed my neck cracking and popping. Seriously, there must be something wrong, right, Doc? Frankly, no. Unless some sort of traumatic event has occurred, car wreck, fall, hit your head, something like that. Popping and cracking is absolutely normal. It's just like popping your knuckles in your hand. Basically, it's movement of joints. Some people think it's gas bubbles in the joints being released. Some people think it's soft tissues snapping over bony prominences. Some people think it's arthritic joint rough surface rubbing on rough surface and kind of ratcheting it around. It's probably some of all of the above. But popping and cracking is not a warning sign of danger. Popping and cracking is completely normal. I mean, when somebody goes to the chiropractor to get adjusted, one of the things that they experience is their joints popping. All that is the chiropractor manipulation pushing the joints further than the patient can push themselves and essentially cracking their knuckles. So that's all that it is. Nothing to be worried about. Scratch that off your list of concern. There are a lot of people that come in with a herniated disc, and they've been told or they understand that some manipulation, some sort of position, some sort of activity can actually push the protruded disc back in place and make it normal again. It can't really happen. That disc comes out, the piece of disc comes out because there's a weak area in the wall of the disc. That disc gets extruded out. It's not like it's a balloon that you squeeze on that expands out and then comes back. What can happen, what we think can happen, is if the disc material is extruded outside of the wall of the disc, the body actually can dissolve that away and shrink that down. Some people find that the initial inflammation related to the disc protrusion settles down and the swelling goes down. But symptoms can get better with the disc fragment still right in that same spot. And so a lot of people assume that, well, the disc fragment must have sucked back in. Doesn't really happen. So it's kind of a myth. Some people will have different opinions about that. Certainly folks who work in the spinal decompression world out of the chiropractic world suggest that spinal decompression, traction, elongation of the spine can suck in nutrients, suck in hydration, potentially suck in disc fragments. I'm not a big believer in that, but frankly, none of us know exactly if that's occurring or not, because we don't have any way of looking at it real time and measuring something. There's no data. Okay, so moving down the list, we're getting to the bottom here. Back pain is a danger sign of something bad. So somebody has a lockdown episode or has chronic back pain, either an acute or chronic problem, and immediately it's got to be something bad that's got to be fixed. It's not normal. Frankly, that's not very true. The vast majority of times people have low back pain, it's because of some triggering event in an acute situation, a triggering event that then stimulated the body to respond. So many times that's an irritable joint, an irritable disc, some irritation within the muscle tissue. The muscle tissues respond, go into spasm lockdown, and that's where the lockdown phase comes into play. It doesn't mean something's been damaged. It doesn't mean something's diseased. It doesn't mean something is harming you. The vast majority of time when that occurs, it eventually resolves. Now, people with more chronic back pain problems associated with things like degeneration of the discs, like degenerative instability where parts move more than they should because the connections have worn down, people who have arthritis changes in their back, those type of people have constant back pain that fluctuates as well. Even with those, that type of pain is not a danger signal of harm befalling you. I think of it this way. It's like rusty hinges squeaking. These parts are irritable. They don't like to be put in certain positions or move in certain ways, and they cause stimulation to the body, which is perceived as pain. Now, there are a couple of back problems where pain can be a danger warning sign. Just like when you have a heart attack, and many people have chest pain and pain that runs down their arm, the pain in their arm doesn't mean that their arm is a problem. It's the nerves around the heart that are referring down to the arm. Well, in some patients, especially if they have an infection or cancer in their bone or a fracture, can have pain that is different than the run-of-the-mill back pain. We have to listen to the story. We have to listen to the context. We have to listen to what has transpired over time and how that pain came about, and then what do the pictures look like. So some back pains are warning signs of bad things happening. The majority of back pain is not a danger signal. So that's really kind of a myth that you need to kind of think about. Now, we don't ignore back pain, but we don't hold every type of back pain at the same level of worry. Again, there are a few things that can really be harmful. The majority of things are not harmful. This kind of goes back to the very first topic, which is back pain must be abnormal. It's really not. Back pain is common. Back pain is expected. Back pain is essentially universal. Now, some types of back pain may be problematic because of something that can be repaired, addressed, fixed. Some types of back pain may be associated with bad problems like infection, fractures, tumors. But the majority of back pain is really just a normal part of the process of changes in your body as we use it, as it wears down, and as our lifestyles affect it. So, again, in the majority of cases, frankly, back pain is considered a normal problem. Now, that doesn't mean that we like it. It doesn't mean that we ignore it. We can help manage it, but it does mean that we don't need to be afraid of the majority of types of back pain. People ask about, Doc, what's the best mattress or pillow? There is none. It's whatever's most comfortable. Some people used to say, oh, you got to have a firm mattress or a squishy mattress. Frankly, it's a personal choice. For me, I found that the squishier the mattress, the more stiff and discomfort I have in my lower back when I wake up. The firmest, hardest mattress, the more stiffness and pain that I have when I wake up. I kind of like a moderately firm mattress. I don't like mattresses that are hot. So, it's a personal preference. There is no magic. And how can you tell that? Because if you go to a mattress store, there's a gazillion models of mattresses. If there was an ideal mattress or an ideal pillow, there would only be one. And everybody would make the same mattress. That's a little bit of a clue. That's another support of back pain is essentially universal. Look out there. How many people see chiropractor offices, massage therapists, physical therapy offices, stores that sell chairs and mattresses and pillows and supports, braces and medications, all of these things? Why is there such a huge industry of this? It's because we don't have the answer. Back pain is universal for the majority of the population, and we try things that work or don't work. There's no recipe or cookbook that works for every single process. So looking out there and seeing how many options are available to you should suggest to you that maybe this is kind of a problem that doesn't have a specific answer. Okay? Kind of the last thing, and then we'll wind it up. If you have surgery on your back, that means you're always going to have more surgery. You'll be in line for another operation before you know it. Well, some people live that misery. I don't think necessarily it's the surgery that created the need for future surgery, although it can have an effect. I think what it is when we do surgery on a problem, we're treating that current problem, what's happening right now. We don't have any way to affect how the body responds to that surgery, and particularly how the body continues to break down and age. So all the other parts that we didn't operate on are still aging and wearing down and changing. And so we can do an operation and have a good result in that area, but just basically Mother Nature and Father Time start giving us trouble in adjacent areas. And that's where you see some people have surgery after surgery after surgery. Now, there are some times when surgery after surgery is related to either a surgery gone bad, a surgery that had a complication. Many times it's dissatisfaction, or for better terms, it's more lack or failure to achieve a patient's expectation where they have continued pain and they're seeking an answer to get rid of the pain. Unfortunately, surgery is not a magic bullet. While many operations can be extremely helpful in helping people, I would never tell a patient that we can guarantee make them normal or make them pain-free with an operation. Why is that? Well, I'm taking a problem, a spine problem of deterioration or damage, and I'm inflicting trauma on the body, doing surgery, to try to help the symptoms from that problem. But there are consequences to surgery too. Scar tissue, changes in the alignment, changes in the mechanics of the spine. And there's just no way that anybody can expect to be pain-free after surgery. Most people who have a successful outcome are extremely satisfied with their surgery. But they may have episodes of discomfort or some degree of discomfort afterwards that they can accept. That's still a good outcome. They still are far better than they were before the operation, but they're not normal. Frankly, I think the expectation of the human brain to expect to be pain-free their entire life is really unrealistic. I look at it this way. The body changes. The machine doesn't regenerate itself. It goes from being in perfect tip-top shape and gets worse over time. Now, some people drastically get worse. Some people have a very gradual, but they all change. I mean, where is it that you've seen an older person without any wrinkles, gray hair, saggy skin, bad eyes, bad ears, arthritic joints? It really doesn't happen. Now, there are some people who are very lucky. They have very little, if any, discomfort throughout their lives. There are some people who have lots of discomfort. Doesn't mean that's not normal. It just means they're different. So we have to be really careful about expectations of how much should someone expect to live with compared to what medical science, whether that's invasive, non-invasive, whether that's Western or Eastern, whether that's holistic or not, medication, surgery, etc., what those things can accomplish. Because none of those things can accomplish an absolute 100% relief of a problem. So it's not black and white, it's very gray. Anyway, so those are some of the myths that I hear a lot. Those are some of the myths that I see on the internet. I hope this has been interesting to you. I hope it's been a little educational. In this day and time when we're stuck at home, there's a lot of bad or sketchy information on the internet. We need to be very careful about what we really believe, all the way from the top down. So I think the best tools for somebody with a back pain problem is, if they're concerned about it, they should see a physician. We here at TOA have many physicians who are spine-related physicians. We have lots of experience. Go to TOA.com. You can find a physician close to your area and make an appointment. We're happy to see everybody. We can't promise that we're going to cure everybody, but we certainly can promise we're going to give everybody their due and help them as much as we can to try to live a better life. So, with that said, be safe, be kind to one another, be smart. Even though Middle Tennessee is starting to open up the economy, that doesn't mean the virus is gone. The virus is still there. The virus is going to be with us for a very long time. So be smart. Contact, social distancing, masks in public. Those are things that will help us slow the progression of this disease until we're able to find something that is either a major treatment or a cure, such as or a vaccine that can help prevent people from developing it. Fortunately, it looks like it may be less truly deadly than we had initially thought, but we're still in the infancy of information. So this is an ongoing problem. It's going to be a problem for a very long time. Be patient, be kind to one another. Go out there and live your best life.